The challenge of finding a sustainable approach to chronic care is one of the greatest social, economic and political challenges facing societies, not only here in the US, but around the world. Our partners Fresenius have published research today showing just how far short the US is still falling in the leap from episodic acute care to integrated chronic care.
The survey is just a wonderful framework for really quantifying perceptions that are otherwise very difficult for us to get into a quantified format and start to be able to act on it.
At a population level, patients are confused and scared when they're diagnosed with a chronic condition. And at a system level, providers are frustrated with the impediments they've got to communicating with each other.
There's a whole series of misperceptions. So there are gaps in communication between physicians caring for a patient or among the care team helping care for a patient. There are gaps in communication between the patient and their support network and the delivery system, the care professionals.
I'm in meetings with physicians all the time, and I get the question, well, it's not our problem if the patient won't engage. And actually, I think if we believe in keeping communities healthy, it's our job, it's physicians' job, and it's clinicians' job to actually reach out and pull and keep pulling till you keep those patients engaged. At the end of the day, for them, it's about how do they deliver care differently.
I think there's as much of a sociological and a cultural change that needs to occur and is slowly occurring that is required for us to really manage the chronically ill well.
There's always more that can be done to better integrate data, but actually figuring out how to get it into the physician's hands or, again, into the consumer's hands and have the consumer act on it. The idea of doing the analytics, which is, you can do in a back room, to actual behavior change.
It's not going to come top down. It's going to come from caregivers in the field saying, I've experienced this with my patients, and I have a system now for feeding that information, that intelligence, into an organized process that allows the entire country to improve. It's going to be, it's the most exciting time in healthcare that I can remember.
One of the major problems for our patient population is fluid overload. Patients ended up with about 2.5 kilos too much fluid chronically on board, resulting in multiple admissions for congestive heart failure and over time slow deterioration of cardiac function. What we were able to do is we actually identified a company that had a piece of technology that would allow physicians for the first time to quantify the amount of fluid that a patient had on board when they came in and how much was being taken off as the treatment went, and over time making sure patients got that extra 2.5 kilos off. To use it effectively, the clinicians in the clinic had to know how to use it, the nephrologist had to know exactly how it was being used, and it had to be coordinated with patients during their inpatient stay. What we really needed was a system that could implement that idea across sites of care, and then a team that would help make sure that all the providers in the sites of care were working together. Where we've done it successfully, we've reduced fluid overload admissions by 50%. It's a huge benefit to the patient population. It just can't be done in a siloed fee-for-service environment.
I'm greatly encouraged that we've pretty much got one example under our belts. We're right in the throes of launching another. And if we can do this consistently this year, next year, one, then two, then three, then 5 projects at a time, we'll be in a position where we've created that learning organization that is caring for patients on an individualized basis against national norms with a very well-defined process of managing the experience of care for those patients.